Let's talk today about vision correction surgery, specifically implantable contact lenses. I get very excited about implantable contact lenses because among all the patients I've seen, implantable contact lenses generally are the happiest of all my patients. These are designed specifically for patients with high prescriptions, generally in the high end of what could be treated with other surgeries like LASIK or SMILE, or beyond the range that those surgeries can treat. For this reason, the change in lifestyle and the benefits of the procedure often outweighs anything else that we perform at our surgery center. But these surgeries very, very effective once again for these high prescriptions. Now the thing about them is it is a prolonged process. Takes a little bit longer than the laser surgeries, but the results are totally worth it. So the procedure itself is a two-step process. Step one is we have to do a quick laser procedure in the office here. It's called a YAG, peripheral iridotomy. What that does is a laser is applied to the structure called the iris, which is the colored part of the eye, and it allows the fluid to drain around the lens in a safe manner. So once the implanted contact lens is placed there, the eye pressure does not build up. It's a quick procedure. Generally, both eyes are done the same date in the office. Patients sit at an instrument. A laser is applied. Unfortunately, there can be a split second of discomfort, but then generally back to normal. Eye drops are used for a short period after the surgery. The second step is the actual implantation of the lens. Each lens is custom ordered for patients based on their prescription. Unfortunately, we do have the opportunity to correct astigmatism and other things. So we do have to wait generally 1 to 2 weeks after the first laser procedure to proceed with the actual lens implant. That is done at our outpatient surgery center. Our outpatient surgery center is about a mile from our office. It is a very fast procedure, taking less than 45 minutes. Many patients choose to have both eyes done the same day, or they can be done separate days. During surgery, or prior to surgery, the surgeon uses strong drops to dilate the eyes. The surgery itself is fairly simple. The surgeon uses a laser to create some tiny incisions in the outside structure of the eye called the cornea and slip the lens in front of your natural lens and behind the iris, which is the colored structure of the eye. So it leaves all the structures of the eye intact. It doesn't disturb the normal anatomy, and it's all done through a very small incision, less than 3 millimeters. That seals itself in almost all circumstances without incision or any other issues. Patients are seen in the office the next day. Most patients have a very drastic vision recovery and can resume most activities. There is some range of vision, so you may need 3 to 5 days before resuming normal activities like work or driving. Eye drops are necessary for 4 weeks after surgery, and you'll get written directions for those, and they're also used for 1 week prior to surgery. We generally follow up within the first month, and then at about 2 to 3 months after surgery to ensure everything is healing as appropriately after the 1 day. Vision recovery, like we discussed, is very fast, but there may be a period of delayed vision recovery. There are some side effects of this surgery, like any surgery. The number one side effect is some dry eye that can occur after surgery. The eyes do tend to be dry for 3 to 6 months after any surgery. To help reduce dry eye, we do offer a 2-step process prior to surgery. We call it the ocular surface package. It's a quick in-office treatment. Step 1 of this is a gentle cleaning of the eyelids and eyelashes to remove any of the excess debris or bacteria that can live there. That helps to promote safe surgery as well as reduce the likelihood or reduce dryness that can occur after surgery. Step 2 of this process is a warming and massage of the glands in the eyelids called the meibomian glands that help produce the oil in our tears. The procedure is fast and comfortable. It promotes healthy natural tear production over time. Results of this procedure have been shown to last up to several years. Ultimately, in addition to these treatments, we do recommend the use of artificial tears after surgery. The second side effect of this surgery is likely some glare and halo around lights and just some final settling of the vision clarity that can take some time. Most people have good vision within 3 to 5 days, but full settling and realization of the results could take 1 to 3 months. There are some rare side effects of surgery that are possible. Side effect number 1 with this would be a small chance of a retina detachment. Retina detachment is very uncommon. Unfortunately, patients who are candidates for this surgery, because the eye length is longer than average, that's what makes patients very nearsighted, are already at higher risk of retina detachment regardless. But if patients did experience any symptoms like flashes of light, curtain over the vision, or hundreds of floaters in the healing period, that could be an emergency and we would want them to contact our office. The rate of retina detachment is less than 1 in 100, and it is treatable should it happen. There is a small chance of eye pressure rise after surgery. If that does occur, additional surgical procedures like a repeat of that initial laser that's necessary, or eye drops could be necessary to control that. That is very uncommon. There is a small chance of cataract formation. If that does occur, very uncommon. Generally, it's more of a long-term issue. The implanted lens and the lens below would have to be removed. That is a treatable condition should it happen. And then because it is an inside of the eye surgery, there is a very, very small chance of an infection. Infection is very rare and also treatable should it happen. It is important to note that these issues, though they are more major, are very, very rare and do have to do with the inside of the eye nature of the surgery. They all are treatable and almost all would offer a full recovery and resolution with treatment. Finally, our hope is that we do this surgery and it fully corrects the vision. Most patients will have this circumstance. Now, it is possible that additional prescription could be, a patient could heal with additional prescription. Should that happen, additional enhancement could be performed, such as LASIK surgery, to adjust for a small prescription patients could heal with. So if that does occur, adjustment could be necessary. Ultimately, the good thing about implantable contact lens, though, is they are a custom ordered lens placed individually in your eye, designed to correct the prescription, providing long-lasting vision results. Now, with this correction for patients above the age of 40, so patients, once they reach the age of 40, reading glasses will be necessary for close vision. So the results are for long-term distance vision correction. Does not correct the close vision after the age of 40, so reading glasses would be necessary. Now, for patients that don't have surgery, it still happens. You just need to wear bifocal glasses or bifocal contacts. It's a process called presbyopia that affects everyone over the age of 40. But in summary, implanted contact lens, very safe, very effective, very high satisfaction rate. It leaves the normal anatomy and structure of the eye intact, adding in this contact lens that no one can see, you don't feel it, and it promotes long-term excellent vision clarity. In fact, because of the limitations of glasses and contacts for high prescription, many patients do feel their vision correction after implanted contact lenses is better than anything they've had before. Very exciting surgery.
Picture going from this to this. Well, that's the difference between poor vision and sharp, clear eyesight you may achieve with Vision ICL. If you're ready to break free from visual limitations due to contacts or glasses, take a look at Vision ICL, an evolution in visual freedom. Vision ICL is a specially designed lens that's gently placed in the eye for maximum comfort and lasting results. The biocompatible polymer lens material of Vision ICL functions in harmony with your natural eye, provides protection from UV rays, and is completely removable should you desire future eye procedures. Improving your vision means seeing the world as it was meant to be seen. So, if you qualify, break free from glasses and contacts and turn to Vision ICL, the premium technology that can produce exceptional vision, is compatible with your natural eye, and has patient satisfaction over 99%.